All right, we're picking up here with the second part of different theories. On this slide, you see the biomedical treatment. So that's treating the nervous system. The first one there, psychosurgery or ablation. We talked about the lobotomy. That would be a good example there, where you are destroying brain tissue. Electroconvulsive therapy, again, that is administering electric shock to try and rewire the brain and create new neural connections and destroy the ones that are causing irrational behavior. Still used today for major depressive disorder when all other treatments fail. Psychopharmacology, or administering drugs for mental illness, would be 4 different categories. Antipsychotics, that would treat schizophrenia, and the typical ones are Thorazine and Haldol that you'll see. And again, they decrease the level of dopamine in someone with schizophrenia. Antidepressants, the 3 most common that you'll see is Prozac, Paxil, and Zoloft, and they work by increasing serotonin in the body. Lithium, that treats bipolar disorder, that keeps the serotonin levels even instead of rising and falling. And anti-anxiety meds, Valium, Xanax, or Ativan are the ones that you frequently see. So here we're looking at treatment from a psychoanalysis perspective or psychodynamic perspective. And again, from this perspective, we act the way we do because of unconscious thoughts or childhood experiences. So they use free association as their treatment, their form of therapy, to try and figure out what is unconsciously driving someone's behavior. And they also talk about dream analysis as well. So a behaviorist during therapy is just simply trying to train someone to change their inappropriate behavior. So for phobias, they use exposure therapy, exposing people to their fears. The thought is they'll become comfortable with it and they'll stop engaging in that behavior. Systematic desensitization is exposing them to their fears in small steps and providing a relaxing environment. Aversion therapy, that is if somebody is, if you want to change someone's behavior, you apply something unpleasant. So I gave you the example of a child sucking on a binky, dip it in mustard, or something they don't like, and they'll stop using it. So aversive, think of unpleasant. Token economy, this is giving someone a token or a symbol that they can trade in at a later date for some type of reward. So a cognitive therapist believes that it's our thoughts that are causing our behavior. So during therapy sessions, it's like educational therapy. The attempt is to restructure someone's thoughts, and ultimately that will change their behavior. And this was created by Allport. All right, so from the humanist perspective, again, this is Rogers and Maslow. They're trying to increase your self-esteem, your self-image, and ultimately that will change your behavior. During therapy sessions, Carl Rogers came up with what he called client-centered therapy so that people could develop their unconditional positive regard, similar to self-actualization for Maslow. This involves active listening. So you simply just listen to the person talk and then you analyze them and you kind of rephrase what they've said and you echo it back, but very non-judgmental. And then they somehow become aware of their issue and they resolve it on their own. Right, on this slide, you see the theories of motivation. First of all, instinct. Some of our behaviors stem from innate reflexes that we're born with, such as the rooting reflex. Drive reduction. Sometimes we're motivated because we have an internal need and we're driven to reduce it or satisfy it. So if you're hungry, you go eat. If you're cold, you go get a blanket. So the goal of the drive reduction theory is homeostasis. We want an internal balance. We don't want to be too hungry or too full. We don't want to be too cold or too hot. Incentive, that's an external theory of motivation. So we sometimes do things to get a reward or avoid a punishment. Arousal, again, we don't want to be overstressed and we don't want to be too bored. We want that optimal level of arousal. Hierarchy of needs, that is Maslow's hierarchy of needs. He said that we're motivated at different levels, and basic levels need to be met before we can move to higher levels. So at the bottom, you have food and water. And if that's met, then you work on feeling safe and secure. If that is met, then we focus on relationships. And if that is met, we look at self-esteem needs. And the top level is self-actualization, reaching all of our goals that we had set for ourselves.